Hi guys, Professor Hussein here, and in this video I just want to kind of give you guys a general idea of what a healthcare administrator actually does. Okay, because I know it might be a funny question or a funny topic because you're all, if you're not in public health, you're at least in health administration or public administration or something like that. So you probably have an idea of what you can expect as a career. I hope you do, or you would think, but I think some of you guys just sort of picked it. Okay, maybe someone told you to, someone said it would be a really great idea, or maybe you just needed something to pick and you thought, well, healthcare, I don't want to be a physician, or a nurse, but I want to work in healthcare. Why not health administration? That's kind of, I don't want to say that's how I got into this, but it's kind of the mentality that I had, because I originally actually majored in biology, and then I just kind of went into the business side from there. But I do want to actually go ahead and go through some of the just typical tasks that you would most likely be responsible for as a health administrator. Now, these are just very general tasks. There are many different things that a health administrator would do. And it kind of is going to depend on the type of facility, the organization, the specific job title, things like that, the level of responsibility you have. But, these are just typical things you can probably expect just at least a few of these things that you would be responsible for if you get a job as a health administrator. Okay, so first of all, you would be expected to conduct market market analysis to understand the growth of your business, or the business you work for, and the revenue drivers and the motivations of the business. Okay, you would also have to manage the financial operations of that business, or you would probably have to manage financial operations of that business. To what scale, it may be dependent on your actual level or your job title, okay, and the level of responsibility that they give you. So this can include, this would be like daily and annual reporting, okay? Then a third thing that you might have to do would be to lead clinical and business professionals, okay? Meaning you would be managing possibly nurses, physicians, and other, business professionals, other technicians, or whoever, is working in your office or your department. So you would be managing them, okay? Or leading them is probably a better word to say. And this would include trying to explain the needs of the business to them, helping to improve maybe their performance on the job. You would also try to find ways to help improve like the clinical quality of your organization, and overall you want to increase the growth, right? So you would be leading whoever is working in your office or your department in that way. Okay, and then the fourth thing that you might be doing is overseeing staffing. Okay, so this would include hiring, training, recruiting first, then selecting and hiring, training, evaluating their job performance, providing them with reviews, and ways that you can further on their training and help them become more high-performing employees. This is actually an HR task, but typically these days HR, the veil between HR and management it's going away, okay? It's dissolving. Many HR tasks very specific HR tasks are being outsourced, to maybe freelancers or even HR companies, and a lot of just typical human resource management is being given to the line managers. So as a manager or an administrator, you would be dealing with a lot of the selecting, hiring, things like that. And then a fifth thing that you might have to work on as a health administrator would be to prepare the healthcare facility for quality and accreditation visits. Okay. Sometimes the health department is going to check up on you. Sometimes you're going to get a peer review organization, maybe an agent is going to come and check up on your Medicare cases. And, you know, sometimes it's the fire department. Sometimes it's, you know, any kind of governmental agency.